Hello everyone, this is Dr. Rahim. Hope you are doing well in your preparation. In this video, we'll talk about PSA. The beginning, we'll talk in general about PSA, and after that, we will put an approach on how to deal with such a scenario in OSCE exam like Black 2 exam. So what is PSA? PSA is a short word for prostate-specific antigen. It is a normal protein that secreted from prostate gland in men. So it is already present in the blood. Okay, but with a certain amount corresponds to the age. For example, if a person aged 50 to like 69, so the PSA could be raised up to 3 nanogram per milliliter. It could be lower than that, but it could be raised to this point. Below 50, it could be lower than that, like 2.5 nanogram per milliliter. And higher than 70, it could be higher than that. You should put this into your consideration when dealing with a patient who is requesting or demanding a PSA testing. Okay, there is a false belief. A lot of patients believe that PSA is a very sensitive test for prostate cancer. Actually, it is a specific test, but not sensitive test, because PSA, the protein, could be secreted from prostate gland in a situation like BPH, enlarged prostate, or even in infection of the prostate or urinary tract infection. Even in normal situation like vigorous exercise, some certain type of sport is after ejaculation, after digital rectal examination. So all of this can increase the amount of PSA. Also prostate cancer. So prostate cancer is one of the causes, but it is not the main cause to increase the PSA in blood. So how accurate is this PSA test? Usually 3 in 4 men with raised PSA will not have cancer. Okay, 3 in 4 men will not have cancer. And also PSA test can miss about 15% of cancer. So I mean by that, it will come as a false negative result. What is sorry? It will come negative. It will come negative, and the cancer is present. Okay, it will come negative. So it is false. It is false negative result. It will come negative, and the cancer is present. But in the hospital, in the clinic, if a patient aged more than 50 came to the clinic and wanted to do request a PSA level, he is over 50, aged 50 or over, so you should do the test. Okay, you can arrange it for the patient, and the NHS will cover this test. All this information is from the NHS. But before this, try to exclude cancer and try to convince him that it is not a sensitive test for cancer. Okay, in order not to go for some invasive or more invasive testing. So before having the test, this is the advice. But exclude prostate cancer or any condition by taking history. We will know how to do this in the station just in a minute. And you may also examine the patient, do digital rectal examination to examine the prostate gland, so in the station. But if the patient insisted to do the test, you should give him this advice. First of all, no ejaculation in the past 48 hours before the test. Also, no vigorous exercise or heavy exercise in the past 48 hours. And no active urinary tract infection. Also, no prostate biopsy in the past 6 weeks. Okay, you need to memorize this information, because if the patient insisted, you will give him this advice, and you will prepare him for the test by giving him this instruction. Okay. So if the test came back positive and it is high, you may need to do biopsy. Sometimes you will do some radiological studies before doing a biopsy to exclude the cancer, but you may end up doing a biopsy. And if the biopsy came back positive for prostate cancer, there is 3 possibilities you may do. Just watchful waiting for this cancer, and usually the patient will be old age patient, like 75, 80 years. May do active surveillance or radical prostatectomy, and you just need to memorize the name of the steps, because as we mentioned before, you are on FY2 and you will refer the patient to a specific department, to a specialist who will talk to him in detail about this. Okay, so this is the detail of the station. Also, you need to know this information. Biopsies 1 in 5 prostate cancer can sometimes cause complication. The most common are bleeding and infection. You need to memorize this. 1 in 5 prostate cancer can sometimes. So prostate biopsy, like any invasive intervention, can cause some complication. The most common one is bleeding and infection. So how to approach this station? The patient will come to you in the clinic requesting a PSA. So after introducing yourself, confirming the patient name and age, so ask him, why do you want to do this test? So he will give you some information, like one of my relatives had prostate cancer, and he told me that PSA is a specific or sensitive for prostate cancer. One of my friend had prostate cancer, and he told me about it. Or even I read some posts on Facebook or on the internet about PSA. So try to build a rapport with the patient. Ask him about his relative or his friend, how's he doing, and just build a rapport with the patient, okay? And ask him how much does he know about PSA in the beginning, okay? Because this will save a lot of your time. And if he say it, he said the information in correct way, there is a patient. All this will increase your interpersonal skills in a station like this, okay? And tell him, assume his name is Mark. Okay, Mark, can I have a little chat with you? Exclude if you have any symptom, or to be in a better situation to address your concern, and ask him a couple of questions about the prostate cancer, like any symptom. Do you have any symptom at all? Any symptom of prostate cancer? If he knows the symptom of his friend or his relative, like he's going to the low more often than usual, burning sensation. We have obstructive symptom for prostate cancer and the irritative symptom of a UTI, a complication of cancer, or a late complication of cancer. Back pain, difficulty starting urination. You may ask him like 3 to 5 questions according to your time. Okay. Do you feel like you are not completely able to emit your bladder? Weight loss, past medical history, you may cover it. A loss of appetite, bumps or swelling in the body, family history of prostate cancer, according to your time. Try to manage your time. Choose a specific question, like 3 to 5 questions about the cancer itself, the family history, and ask him about also smoking, because it could be a risky factor for prostate cancer. Okay, coming to the management. Before the management, examine the patient. Ask the patient that you need to do examination to make sure that he doesn't have this cancer, or to make sure about the health of his prostate gland. And you will examine the prostate gland by digital rectal examination, and tell the patient the whole detail about prostate, the digital rectal examination. Nowadays, they can bring a station like this, a combined station, PSA requesting or demanding the patient, and the rectal examination. Okay, so make sure that you have seen the mannequin, and make sure that you manage your time, and you make sure that to leave enough time for doing the examination itself. Okay, so it is a combined station. Okay, after examining the patient, he usually is normal. He will be normal. He may have some enlargement. According to station, it is different from station to another. Okay, coming to the management part. So thank the patient for letting you examine him and taking this information, and give the patient some information about PSA. Like PSA is an inaccurate test, okay, because it can increase in normal state, or even in some pathological conditions, some problem in the prostate gland, like prostatitis infection or enlargement of the prostate. It is not even increased on cancer, okay. The patient insisted on doing it. Okay, tell him that the test can come back positive, but the patient may not have the PSA, okay. So at this point, we will move to the next step, which is taking a biopsy or doing some radiological investigation, which carry some complication, and tell him about the complication, okay. So after that, the patient test usually should be older than 55, so you are allowed to do to proceed with the test, okay. If the patient insisted, okay, no problem, just arrange for the test. And as I mentioned before, give him the information or the instructions that he should do before doing this test, like no ejaculation in the past 48 hours, no vigorous exercise in the past 48 hours, no infection, no urinary tract infection, and no prostate biopsy in the past 6 weeks. And arrange a meeting or to do the test for this patient in your situation, in your scenario, by asking the patient if he need more information at any time. Just he can contact you to gain this information, okay. This is about PSA requesting a patient or demanding a patient. Subscribe the channel and wait for the next videos.